For Macular Degeneration Awareness Week, we are pleased to welcome Dr Vivek Pandya, who is a Vitreo-Retinal surgeon and macular specialist, with expertise in the treatment of surgical retinal conditions, medical retinal diseases and complex cataract surgery. Dr Pandya was the recipient of the 2020 RANSCO Leadership Grant after successfully developing a Vitreo-Retinal surgery unit at Liverpool Hospital. Thank you so much, Dr Pandya, for talking to us about macular degeneration for the upcoming Awareness Week.
Thank you, Tessa. It's a pleasure to be here.
What is so important about my macula?
Starting with what the macula actually is, it's a very specialised part of the retina where it's got a high density of cells, and these cells are what gives you detailed vision. So the ability to read, to recognise faces, being able to appreciate all the colours of the spectrum, and anything else really that requires really what we call high acuity vision is done by the macula. So the macula is only about 5 millimetres in size. It's directly at the back of the eye, and the rest of the retina is more the peripheral retina, which is important as well, but it has far less functionality compared to the macula.
Wow, so what is macular degeneration?
So, as the name suggests, it's a degenerative disease. The macular tissue is supported by a special layer of cells at the back of the eye, which is called the retinal pigment epithelium. Now, the retinal pigment epithelium, or the RPE, is a metabolic workhorse. It's important for nutrition of the retina. It's an important barrier to make sure that any unwanted substances don't enter the retina. And when it doesn't work well, you get the buildup of waste products under the retina, and then you can actually get loss of the retinal pigment epithelial tissue itself. When you lose that barrier function, first you can end up with areas where the tissue is just gone, and those can correspond to patients having areas of their central vision which is quite significantly affected. The barrier function also means that the vascular layer, which is outside the retina, cannot breach into the retina itself. So we do talk about neovascular AMD, or wet AMD as it's also known, is where an abnormal blood vessel can grow through a breach in the RPE layer, and this leads to leakage of fluid and blood in the retina, which can cause quite dramatic damage to the central vision.
What are some of the risk factors for macular degeneration?
Macular degeneration certainly has some genetic risk factors, but also environmental ones. And it's an interplay between the two that leads to the actual disease. The most common risk factor is age. The older you get, the more common the disease is. Family history is significant, and certainly if you do have a parent or an uncle or aunt who has macular degeneration, statistically speaking, you have a higher risk. The genetic basis, however, is still incompletely understood. So there are no specific tests for macular degeneration that are in common use or in common practice. The other big one which I wanted to mention is smoking. Smoking is a modifiable risk factor. You can't change your age, you can't change your family history, but you can stop smoking. And we know that if you are a smoker, then you have a higher risk of developing the neovascular macular degeneration, which we spoke about earlier, and your response to treatment is often poorer as well. So this is a big one that is modifiable and really it needs to be emphasised.
And something we can control. So when should I be getting my macular health assessed?
Well, I think any time is a good time to be having your macula assessed, but as we discussed earlier, age being the most important risk factor, I think everyone over the age of 50, and perhaps even younger if you have a family history, it would be very reasonable to attend your eye care professional to get your macula assessed. Detailed macular assessment involves some simple things like a vision test, but also more detailed things such as scans or other investigations to delineate the actual structure of your macula to see what's going on. These are now very commonplace and is the standard of care for screening for macular degeneration. One of the things I also wanted to mention is that you can do a bit of a screen for yourself at home. There is a thing called an Amsler grid. Now, this is just a very simple grid of squares which you look at. Our common advice to patients is to put it on your fridge, and as every morning when you go past your fridge, you can just test your eye to see whether the lines are straight or whether in fact they're curved or there are areas of that Amsler grid that are missing. This can be a very sensitive sign of something going on with your macula and can be a good prompt for you to come in and seek care.
That's really great to know. What would you say are some important lifestyle habits we can employ to maintain a healthy macula and vision?
Broadly speaking, a healthy lifestyle is only going to be beneficial to you generally, but also specifically to your eye health. Being physically active, regular exercise, and certainly having a healthy, balanced, nutritious diet would be very beneficial. In relation to macular degeneration, there is good evidence that certain nutritional things are of great benefit. So certain minerals and vitamins. There are specific dietary recommendations such as consuming fish 2 to 3 times a week, daily consumption of dark green leafy vegetables and fresh fruit. These contain these trace minerals and vitamins which will be beneficial. And really, I think these are good lifestyle habits anyway. We're not talking about anything that's difficult to keep to, it's just good common sense.
On that note, can you tell us about supplements for macular degeneration? Should people be taking them preventatively or only if already diagnosed with macular degeneration?
So there are 2 groups of supplements that I want to talk about. The first is just dietary supplements, taking omega-3 supplements or lutein or certain trace vitamins. There is no strong evidence to support the routine use of these supplements, particularly when you are maintaining the healthy dietary regime that we spoke about. Our recommendation would always be to be getting these nutrients through a healthy diet rather than using supplements. More specifically, there's been quite a lot out there in terms of the AREDS2 supplements, which are available very commonly in your local pharmacy. This is a specific formulation that's been studied in large population groups and published in the medical literature for very specific groups of patients. So you would need to consult your eye specialist to see whether or not it will be indicated for you. But briefly, if you have what we call intermediate macular degeneration, taking the AREDS2 supplements can reduce the risk of progression to late or advanced disease. And if you have late or advanced disease in one eye, taking the supplements might help you from progressing that way in your other eye. So these are some very specific indications for it. The AREDS2 supplements do not prevent the development of macular degeneration. So if you don't have the disease, I don't think there's any indication to have it. And if you are unlucky enough to have advanced disease in both eyes, then I don't think there's a reason to use it either.
We see a lot of patients that come in for eye injections for their macular degeneration. Can you tell us about these injections?
Sure. So I think this specifically pertains to neovascular AMD, which we discussed a little earlier. The growth of these abnormal blood vessels in the retina are driven by a specific protein in the eye called vascular endothelial growth factor, or VEGF. So we are able now to deliver medication into the eye via injection, which is an inhibitor of this VEGF. By inhibiting the VEGF, these abnormal blood vessels lose their driving force, and they tend to then shrink and regress. The fluid leakage and the bleeding that occurs from these abnormal blood vessels can then resolve. And this usually leads to stabilization of the macula, and certainly in a lot of people they get an improvement in the vision. So these injections are usually done in the office. They're done with anesthetic. It sounds horrific to most patients having a needle in the eye, but it is quite a smooth and well studied procedure. The protocols around it are very sound, and most patients do tolerate the treatments very, very well. There is a lot of research going on about having medications that work for long durations. At the moment, many patients need to have very regular and repeated injections in order to maintain their macula in good health. We hope that in the future there will be drugs and possibly even devices that will allow us to treat people less frequently but still maintain their macula in the best condition possible.
That would be wonderful. And finally, what other resources are available for patients to find out more information on macular degeneration?
The first thing I would say is that your local eye care professional is always a good resource when patients are seeking care. I wanted to mention also the Macular Disease Foundation Australia is an excellent resource. They do a lot of work in regards to patient support, patient advocacy. They've got a number of resources on their website which are easy to access, and there are also they do tend to arrange things within local communities as well. So it's a great resource that's available to us here in Australia, and I would encourage all patients who are affected by macular degeneration to certainly access that.
Wonderful, and we will share some of these resources on our website. A big thank you to Dr. Pandya today for educating us on macular degeneration. If anyone listening would like to discuss or find out more information on macular degeneration, please reach out to us at Sydney Ophthalmic Specialists. Thank you.